My name is Amanda Edlin Smith. I was born with the rare birth defect called medullary sponge kidney, or MSK for short. Now, MSK is a congenital birth defect, not typically seen to run in families. It does happen. There are people who have several cases of it in their family. I'm here to raise awareness today for other MSK patients like myself, and I'm going to participate in the Lemon Challenge. But first, a little bit about MSK. The kidneys don't form correctly, and what should be small tubules that help filter the waste from our body actually form into these cysts or cavities in the kidneys. So if you're looking at CT images or other x-rays, kidneys literally look like sponges. So all the waste just kind of sits in our kidneys, forms stones, causes infections. MSK only affects about 1 in 20,000 people. To date, there's still very little known about the disease itself. There's no cure. And the only treatment right now is to kind of treat the symptoms as they occur. Now, the primary symptoms that you find in a person with MSK is blood in their urine or hematuria, constant UTIs or kidney infections, urinary tract infections, kidney stones, pain, and most people with MSK do have some degree of nephrocalcinosis, which simply put is just calcium buildup in the kidneys. They say the onset of the symptoms usually is between the ages of 30 and 40, but in my case, my very first kidney stone was at the age of 16. MSK does affect everybody a little bit differently, it seems. There's some people who have UTIs constantly, kidney infections, but never really have a problem with stones. They might have them in their kidneys, but they don't pass them. You have people who have a lot of stones, but never a problem with urinary tract infections. You have people who have both all the time, a lot. And there's even a few known cases where MSK is asymptomatic, meaning that there's no symptoms, and they've probably stumbled upon their diagnosis just by having a CT scan for some other procedure. So it was just kind of an accident. Now, like the symptoms, the degree to which pain affects each of us is just as different. Some people experience pain only when they're passing a stone, or if there's an obstruction, if there's an ongoing infection. Now, others deal with daily pain, and a lot of times it's a debilitating pain in which they have to rely on multiple heavy-duty narcotic pain meds just to get through their day. So far, I've been lucky. Don't have to take a lot of pain meds. Pretty much it's limited to whenever I've had surgery or I do have a stone. In my case, I don't have a lot of urinary tract infections. I am what we lovingly refer to each other as a stoner. I wish it was what you have in mind when you hear the term stoner. Unfortunately, it's not. I pass a lot of kidney stones. A lot. I had, like I said, my first one at 16. My second one at 17. That required a lithotripsy to have it busted and pass the remaining fragments on my own. I had a number of years where I didn't have a whole lot of problems. And then I had kids, and it sent my body into chaos. And since the age of about 25, I can typically pass anywhere from 10, 15, 20 stones a year. Oftentimes 2, 3, 4 a month. I can't tell you how many I've passed in my lifetime. I have no clue. I can only tell you that this year alone, I'm working on number 9 currently, and it's not fun. We get a lot of advice from people who have kidney stones every day, and we try to take the advice and be appreciative of those who show some sort of concern, but they typically don't understand that the medications that they get to keep from forming their stones don't really work on us, because that stuff's going to sit in there and it's fermenting and it's going to come out one way or another. I like the lemon juice that I constantly hear. Drink water with lemon. Drink lemon juice straight. Drink vinegar. I'm sorry, I'm not drinking vinegar. That's nasty. That stuff doesn't work. It's not going to break down our stones. It's not going to dissolve stones. Those things are like rocks. They're not going anywhere but out. So, for all of those who keep giving us the advice to drink lemon juice or water with lemon, for 30 seconds, I'm just going to suck on a lemon to show you that I support MSK awareness, and I hope everybody else that watches this video will pass it along. And if you also have MSK, feel free to make a video of your own and post it for all of us. Fortunately for me, I like lemons. They don't help, but I really like lemons, so I'm going to enjoy the rest of my lemon. You guys have a great day.